Hi, and welcome to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation focused on youth mental health. Before we begin today's episode, I just wanted to let you all know that all content that is found in our podcast is created for informational purposes only. This content is not intended to be a substitute for professional medical advice, diagnosis, treatment, or therapy. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something you have heard in this podcast. Thank you so much, and without further ado, let's get started.
Hi, everyone, and welcome back to the Mindful, Beautiful, and Thriving podcast. Today is the second episode of our Therapist Off the Clock series. I am here with Sherry Grandi, who is a licensed clinical social worker. Miss Sherry, would you please introduce yourself?
Sure, I'd be happy to. So I am a licensed clinical social worker, which a lot of people may have seen as LCSW after someone's name. What that simply means is after the 4 years of college, most of us have chosen to go and get a master's in social work, followed by doing clinical work that is under the supervision of a already licensed provider to then be able to sit for our boards through the state of California and many others. Actually, all the states, all 50 states in the US acknowledge LCSWs, a similar process. And so I went and got my master's at the University of Southern California and then worked in various positions according to the practicum that I had in school. Healthcare was my focus, so I worked for Cedars-Sinai and then transferred to Alta Bates Comprehensive Cancer Centers. Long way around, all sorts of healthcare and inpatient psych. I've worked in the criminal justice system. Social workers are pretty versatile, and I'm now in private practice. I run my own private practice where I focus on working with adults who identify as being neurodivergent and helping them navigate a lot of the systems that would be a part of living. In a nutshell, that's me.
Yeah, thank you. It seems like you have a lot of experience in this field, and it seems social work it seems to be a very fun and very rewarding career because you're able to make such a big impact,
I
truly.
love it. It's true.
Would you mind walking me through a day in your life and talking a little bit about what the life of a licensed clinical social worker looks like?
Yeah, I can tell you about my life. Certainly, it's like people. Being a social worker is a pretty diverse profession. It's probably one of the things that drew me to social work as opposed to another mental health discipline. The great thing about working in different systems in the community, hospitals, law enforcement, and mental health clinics, you get to work with a lot of other disciplines. I think you can't go wrong if you're thinking about mental health, any avenue that you choose. I think the greatest thing about social work is that it's so varied, right? It's such a variable day in based on your setting, right? So I'm in private practice, so private practice clinicians see an average of 5 to 6, I would say, clinical sessions. So that's a 50-minute hour session where you're one-on-one with clients. And so my time is spent in session with newer people, assessing and diagnosing clients and their issues that either are perceived or that they're trying to struggle with, trying to work through. I'm specialized, as I said, in working with adults who are neurodivergent. So there's always an aspect of coaching clients to manage their day-to-day life or assisting with their executive functioning skills. That's a big part of what I do. And while running therapy sessions, I also, if I'm not doing that, I will manage my client and colleague correspondence because there's usually a lot if I'm working with other clinicians or physicians. We need to scheduling the time to phone, email, and then, of course, documenting my clinical day, which is probably the least favorite part of what I do, but also very important.
Yeah. You brought up a lot of great points. I think one thing that really stood out to me was when I was researching a little bit about what a social worker would do. In the back of my mind, I always thought that they work with kids in the foster care setting, and that was one thing that like really surprised me of like how many different like specialties you can go into and how versatile this career truly is. A follow-up question would be like, what would you say is the best thing about having such a versatile career?
Oh, I think I mean, just the versatility within itself, the sky's the limit. So a lot of people will choose a profession and then explore it working in a school system, for example, which is exciting and varied and has lots of benefits. But then for whatever reason, maybe decide, oh, I might want to try something different. So as a social worker, you don't have to go back to school or get a little bit of continuing education in an area, but you can make a transition into foster care. You could make a transition into hospitals, community advocacy and activating. And so there's so many things that we can and do. There's the social workers. When you're in social work schools, there's three levels of practice, if you will. So it's micro, meso, and macro. And so micro is what I do. I one-on-one, and that's like directly one-on-one working with a client or individuals, families, family caseworkers would be. Meso is working in smaller groups, local organizations, school social workers, right? And the macro is systems, right? Operating on a system level and it's always social workers are trying to impact change in a positive way. Again, who decides what's a positive way? You can debate that, but like trying to either move our community to make decisions that would be more empathetic to the environment and the people. Truly, that was and what drew me to the field and what keeps me in it is that I always have different, like I said, I've worked inpatient psych, I've worked med surg hospitals, I've worked in oncology, I've worked in prisons, I've worked with gangs, and I mean, there's always something that I'm learning, and so I really enjoyed that. I enjoy just being able to learn from other practitioners, from people that I'm working with. I'm learning every day, and even as a solo practitioner, which was the one thing I was most afraid about, I thought, oh, I'm going to miss out on so much of this interaction and this richness. And it's not the case because I get to talk to people all day long and learn about who they are and what makes them tick and how to help them to live their best life. So it's really rewarding.
Yeah, that's amazing. I love the versatility for sure. And I think it can give you so many different options and
Hmm.
different avenues into different parts of psychology. And also, I love how you can do so many things with this degree, right? You can truly match.
Yeah.
So, as a part in your current practice, you do therapy, you do case
Hmm.
management and advocacy. Can you talk a
Hmm.
little bit about the percentage of your time, like what percentage of your time you devote to each of those three things I mentioned?
Sure. So the bulk of what I do is one-on-one working with clients, families. And so that would be, depending on the week, a good 80%. That's where I live clinically with my clients. And then I guess 75%, because there's always the paperwork and the other stuff. But when I am working with clients, things always come up, right? And because of the group of people that I love working with, that I get the privilege of working with every day, there are system failures built in. And what I mean is the world isn't necessarily built for people that are neurodivergent. So helping navigate healthcare, for example, how to make the go transitioning from all of a sudden you're 18 years old, congratulations, you're an adult, your parents can't call and make a doctor's appointment for you. And a lot of people take for granted, a lot of parenting people, which I am one of, that, oh, you're 18, it just magically happens that you know how to do all this adulting stuff. And we learn by doing, but the system can be a little difficult at times, a little clunky. How do you get reimbursed on insurance when they hand you a super bill and you're, what do I do with this? Or what if your insurance denies coverage for services, and patients or clients will say to me, I couldn't do that because I can't have that surgery because it was denied. And I'm like, no, a denial is we got your paperwork. Thank you very much. Try again. But most people think denial means over. And so helping people navigate, helping to call, writing scripts for them that where they can go through and try managing legal systems, right? So there are weeks where I will have a very heavy advocacy week. I'll have to go to a courthouse to get documentation with a client or do things. So that can might change the balance, and I can be doing more advocacy on certain weeks than I am clinical, but it all evens out. And it's all super fun and interesting. I'm always learning different systems and different people and resources. I think social workers are really scrappy. We have to know how to find different resources and then parse them out to our clients and to other people so that we make sure that hidden gem resources aren't hidden.
Wow. Yeah. Thank you for sharing that.
Mhm.
I think that I love the advocacy part of being a social worker because you get to really stand up for your clients and really truly make an impact in that sense. And I also really loved what you said about the act of helping people specifically that are neurodivergent. It's something that I feel isn't talked about enough, and I truly feel like you're making a really big impact.
Thank you.
I think that's amazing. On a very high level, without obviously giving away confidential information, can you talk about some examples where you would have to advocate for clients and fight a system for them? And yeah, just tell me a little bit about like when would you have to advocate for clients and how would that kind of go a little bit more into the legal side of your field?
Yeah, I think where there's always that kind of fine line. Generally, what happens is when working with people, it would happen a lot in hospital systems, in inpatient psych. Sometimes people were on a voluntary hold, sometimes not. Sometimes a hold was put in place by someone that was not them. Assessing for someone's ability to be able to make those decisions to self-determine would be part of what we would do. Always, if possible, to advocate for someone's ability to use their own voice in their own life. At the very least, to be able to express what their needs and wants are so that they can be communicated to, in some cases, a judge. And it would just depend on, it would come down to, is this person going to a safe environment? And all sorts of different kinds of what is the reason. Sometimes there can be compelling reasons to hold someone, there can be compelling reasons not to, and making sure that the system isn't rolling through a person, that they're seeing what is it that this person wants. And I think one of the times that it really struck me was a time when I was talking to them and I said, what is it that you want? And there were lawyers and police officers and lots of people that have really important jobs. And the person looked at me and said, nobody's ever asked me that.
Oh.
And so to be able to really be there and see each other's humanity, I can't think of a kind of a better case of it. And then unless on a regular daily basis, just really being the person that listens to what people are saying and saying, is this what you want? Is this do you want to go to this place? People will even say to me on a higher level, I'm doing this job, I don't really like it. I'm like, why? And it's because I have to make this kind of money. And I'm like, but what would you like to do? And then people usually know, they'll say, I want to be a teacher, but it doesn't pay well. I'm like,
Right.
but why don't you do it? And talking to people about what they really want and is there a way to make it happen, helping them realize that in advocating for them, handing the baton to them so that they can advocate for themselves and teach others to do the same, because that's how we get more advocates.
Yeah, and I think that, as you mentioned, social work can be a lot about advocating and finding ways to truly stand up for your clients. But that kind of sparked something in me because I'm someone who's has been considering different fields in the humanities, and I was kind of curious, do you work at all with lawyers? And can are there possible paths into law
Oh,
by
yeah.
going into social work? Because I feel like since there's so many ways that you can advocate for your
Mhm.
client, things like that, that can really be a great avenue to go into law. So can you kind of talk a little
Absolutely.
about that?
Yeah, I'd be happy to. And I actually have to check when I was obtaining my master's, there was a joint program. It was MSWJD. So it goes, they're very complementary. A lot of what social workers do need to know aspects of the law as it pertains, and sometimes remind other people that do really important work what the law is and where the line is. When I would come from inpatient psych down to ER, they didn't have social workers on staff where I was working in the ER, but we'd be on call. So someone would be coming in through ambulance and police. We would know that ahead of time. The ER knew they'd call up to the unit, have someone come down. Interestingly, I worked with all sorts of disciplines. Only social workers, only MSWs could come down to the ER, not psychology. I would come and interface with an agitated client on a gurney who would, in one case in particular, was handcuffed and ankle cuffed to, they were agitated. I would be if I was. Police were yelling at them. There was a lot of commotion as they were coming in. And in a quick assessment, so being quick on your feet, it was obvious the person was upset because of they were being tied down. And so I walked over to the police officer and I said, could you please disengage this patient from their cuffs? And, oh, absolutely not. Like they knew much better. And so I had to educate the police officer on what it was, what patient rights were, and where the line was. Not that the person was clearly not a threat, but they were threatened. And as a result of that and that interaction, I was invited to the police station to give an in-service on when you're restraining someone with mental health versus somebody who's wielding a gun and there's obviously areas where police officers must take precautions for themselves, but there's also some where they might go a little too far that it doesn't help the situation. And it's helping to understand some people who are in acute mental distress, like any other distress, lose the ability to say, this is what's happening with me right now, and be clear. So it's up to us, the professionals in the community, to be a little bit more compassionate. I know that LA started having social workers go in police squad cars, right? And so for that same reason, and I have colleagues that have done that. So we have important, but the law comes into play a lot. We have to know almost as much law, not quite, as some lawyers, because we have to know a lot of different areas, healthcare, mental health care, schools, out in the community. What are people's rights? What is not your right? Where is it? Where's the line? A lot of times people say, oh, it's my right to do this. It's not. Or actually, your rights are being violated, right? And so to know that and to be able to have respectful but forceful at time conversations with other members of our community is really important.
For sure. And I think it's a much needed career because we really need people to be able to advocate for others in the community, fight against injustices, really help minorities, as you mentioned, neurodivergent adults. Since you work with them, I think being able to give them a voice and being able to
Yeah.
allow them to be heard is really impactful.
And
Yeah,
elderly, right? As people start, as it like not even start, but we in our society, we have values of we see certain people as worthy and others maybe not as much, which is obviously not the way that I like to look at it. But collectively will decide, or kind of other people. And that happens a lot with elderly who get confused if they're driving, and just how do we admit that we are a very diverse community, especially where we live. And that's not just culturally, right? It's age, and it's how do we all coexist in a way that we all feel safe and valued.
For sure. And I think that kind of gets me into my next question a little about how is social work different than being like a therapist or a counselor. But I think you've touched on kind of one aspect, which is that advocacy that kind of goes into fighting for your clients and making sure that they get what they deserve, they are getting the resources, the help, and the support overall that they need. But can you touch a little bit on that a little bit more?
Yeah, no, of course. I'd say that social work for many of us, myself included, clinical social workers, we combine therapy and advocacy and advocating systems and issues such as employment, housing, and community resources. So I think the difference is some people go into become a therapist or a counselor, and that's really the scope of what it is that their education and where their professional scope will keep them, which is what I do currently, one-on-one counseling therapy. And I think that more practically, LCSWs, social workers that have a master's and have the additional training and then are licensed in the state that they reside, are looking more at the person in the environment, if you will, in addition to providing psychotherapy and diagnosing mental health disorders. We can offer clients essential community programs like we talked about, food stamps, housing assistance, medical care, and we can advocate for policy reform. And pretty much, I just feel like it's not to put down my colleagues who I love very much. I just think that it's much more versatile and it gives us much more breadth of what we can do. And I have taken advantage of by changing and reinventing myself within the career multiple times.
Yeah, it sounds amazing. As someone who is exploring multiple fields of psychology, and for viewers watching this, I think one of the biggest things is how, as I've touched on before, how versatile it is. As someone who also likes neuropsychology a lot, would you say that you're able to do psychological assessments on your clients and do that kind of thing? Yeah.
So a lot of my clients who come to me have a diagnosis of anxiety and or depression. And it's my kind of specialty in neurodiversity evolved out of realizing that at half my client base, then three quarters, then all of my clients are somewhere in the spectrum of ADHD, dyslexia, autism combination, and learning disabilities. And what was common was not a misdiagnosis, because it's not. Anxiety and depression naturally occur when you live the bulk of your life not having an appropriate diagnosis. So a lot of clients will say, I've been on anti-anxiety medication, I've been on antidepressants, they never worked. And then they tell me more about what's happening, and we'll do so. And then it leads to, I think this is what's going on. Can we, if you do you have any interest in exploring this at all? And generally it's a yes. And so then we go into diagnostic, and usually it's autism 1 and or ADHD, and which then brings up a whole other cascading not issues, but it's, oh, this is great to know, and now I'm confused if I look back on my life. And so it brings up more to talk about. And then, so the only thing that I cannot do as a provider is prescribe medication. And for that, then I have a couple of very nice psychiatrists whom I like personally and professionally, and I'm very lucky to be able to refer to. And we consult back and forth. I tell them, they'll ask, what are you seeing? What do you think? What do you think in terms of medication? And so we have a collaborative conversation. Then the client will be seen by that doctor, who then ultimately will write prescriptions or make assessments, but obviously of their own.
Wow, I love that. You pretty much do it all. You have you do a lot, and I think your clients, I'm sure, really feel validated. They feel like they have someone that they can really confide in, and I think that's something that I really value about social work. If you could change one thing specifically about social work or the systems that you work in, what would it be? I know that's a
Yikes,
really
I
difficult
know. I'm like,
question.
well, that's loaded. Yeah, so I mean, I think it would be more changing things in the system. In all the years that I've been in social work, I think it's some of the systemic issues that we haven't really changed, right? We keep repeat, lather, rinse, repeat. I'd love to see a shift away from what I call reactive Band-Aid, kind of underfunded. Oh, something's not going well. Like throw a little bit of money, but not quite enough. We'll throw a Band-Aid on this. And then it's I'd like to see more preventative structural investments in the foundational needs of our communities, right? So we know, for example, currently the system forces practitioners to spend a lot of their time that are in community social work navigating kind of the fragmented, if you will, bureaucratic layers rather than getting in and doing, which is therapy, right? Or getting in and really helping to mitigate what is a problem before it becomes a crisis. And so by actively, it really comes down to resource allocation, transitioning the resources towards, I don't know, universal healthcare, accessible housing, equitable community infrastructure. Social workers, because we're dedicated to using our expertise in true empowerment and advocacy and prevention rather than daily crisis management.
Wow, yeah.
Right.
I think those are definitely huge issues that definitely need to be addressed. And based off what you've told me, I think that we as a society should definitely try to be a lot more proactive and let these issues or find ways to actually solve these issues head on. So, yeah. As we close, I was curious to see if you had any advice for high schoolers who are interested in this field and talk about who would really thrive in this role and who would really make a good social worker.
I think that in high school, if thinking about locally, any organizations like our social service agencies or like our food banks that are looking for volunteers, it's a great way to get some practical experience. Sociology and psychology classes really help. Obviously, your educational understanding of what it is to make sure before you make a commitment at school and to see, oh, do I like it? I think that debate, I always think back about what would be the most helpful in high school and the debate team or anything where you get to hone your communication skills. Yours are excellent, but really have that opportunity to talk with people of all that are different from you, older, younger, doing different kind of things and feeling comfortable with having those conversations. I think those are that. And then the obvious is the desire, having empathy for your fellow human, wanting to be the change and be helpful. The world needs more people who want to change for good, who believe in the goodness of our fellow people, and and I think that those are like, that's what it is. It's not anything so unique, or I used to not think, but I think the warmth and the kindness and the openness.
Yeah, thank you so much. We will be ending our meeting here today.
Okay.
Would you have any more tips or anything that you would like to share? Not, no worries.
I guess the only thing, when if were to decide to go and get, so first of all, having a very broad college education will serve you well. So we used to call it liberal arts. I know sociology, and some schools have psychology, social work, anything that will expose you to lots of other things. So I know it's always, I remember when I was in undergrad, at first I thought I was going to be business. It made no sense, and I changed. And I think as open of a background in education as you possibly can. If you go to get your master's, choose a program that has clinical accreditation so that you have that option and take as many varied classes in all the things that scare you or that you're like, I don't know what that is, because you never know, you might like it.
Thank you so much. I learned so much from you, and I had such a pleasure talking to you.
Oh, thank you.
Stay tuned for more episodes on Mindful, Beautiful, and Thriving. Thank you so much.
You are listening to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation. As part of our youth series, we will be releasing new episodes every month, so make sure to continue to check those out. We hope you enjoyed this podcast, and we thank you so much for listening.